Hello, professor in class. My name is Natalie Franco, and here we are on week 4 doing our video discussion. So here we have a 50-year-old non-binary patient presenting to the ED with complaints of upper abdominal pain, nausea, and vomiting for the past 4 days. So our first question is, what is your initial differential diagnosis based on the information that was provided? Based on the information provided, my first diagnosis, the first thought that came to mind was a right kidney stone. After that, I thought appendicitis, urinary tract infection, or cancer. For number 3, is there any other subjective or objective data that I would want to collect? There's definitely a lot of subjective data that I would like to collect. Some of those questions would be, do you have a history of kidney stones or kidney disease? Do you have history of gallbladder disease? Have you ever had any previous surgeries? Have you ever been prescribed anticoagulants? Sometimes when you're on an anticoagulant, you can start bleeding. How long have you had the blood in your urine, and has this happened before? On a pain scale of 0 to 10, how much would you rate your pain? My main question that concerns me the most that I would ask first is, were you born a male or a female? Depending on your sex is different kinds of disease processes. The male reproductive organs are completely different than the females. Do you have any family history of kidney disease? Why are you taking cyclosporin? And last but not least, are you sexually active? For objective, I would like to do a basic blood work to start off with, a CBC, BMP to check for kidney function, urinalysis, an ultrasound of the kidneys, and then a CT scan of the pelvis. How did your differential diagnosis change after your objective information was reported? So like I mentioned before, depending on the sex of the patient could have a male condition such as prostatitis or prostate cancer that a woman wouldn't have. And if it was a woman, she can have things like an ectopic pregnancy, a UTI, or an ovarian cyst. That's why sex is so important to know. Next, what diagnostic tests would you like to consider offering the patient to rule out or rule in? Like I mentioned before, I would definitely start off with a basic CBC, BMP, and urinalysis, just to get that going and see what the blood is looking like, if there are any signs of infection and kidney function. After that, I would do the CT scan of the pelvis or the ultrasound of the kidneys. And then last but not least, are there any biases or barriers that could affect clinical decision making that would impact the patient's health outcomes? The main bias, like I mentioned before, would be the gender. It's important to know what reproductive organs the patient has to properly diagnose and treat. I do stick to my main diagnosis, like I mentioned before, of the kidney stones. So I would wait until those tests come back before properly diagnosing and treating. Thank you all for listening, and I hope you enjoyed my discussion this week. Hope to hear from you.